Okay guys, for today's video, I'm going to cover low back strain, specifically the Quadratus Lumborum. This muscle causes tons of pain and wreaks havoc on tons of people. Now, today's video is going to put a lot of people out of business because I'm going to give you the shortcut on how to fix it. This is my own personal treatment for it, and it works really well. So the Quadratus Lumborum muscle is probably the muscle that's most responsible for the pain that you feel when you hurt your back. When people say they have a bad back, they're probably talking about the pain that they're experiencing from this Quadratus Lumborum muscle. When people go to try and get their back adjusted, when they want a low back massage, when they're sticking lacrosse balls into their back, all those reasons are because they have a weak Quadratus Lumborum. Now, the Quadratus Lumborum is a strip of muscle that goes from the bottom of the 12th rib and attaches to the top of the hip and actually attaches to every single vertebral body transverse process of the spine. You have one on each side, one on the right, one on the left, okay? The primary reason for the Quadratus Lumborum is to provide spinal stability. You can also use them, so if I were to bend to the right or to the left, my right Quadratus Lumborum is preventing me from continuing to tip forward. If I bend to the right, same thing. Let me show it to you in action. Once again, Juan from Leja Lift is here. He's got some nice Quadratus Lumborum muscles. So we're going to show you those. Okay, so to the untrained eye, it really looks like just back muscles, right? But the Quadratus Lumborum is going to be from here to the top of the hip and from here to the top of the hip. Go ahead and bend to the left, and you start to see the Quadratus Lumborum muscle here. Bend to the right, and you see the Quadratus Lumborum muscle there, okay? So when you use them one at a time, they bend you to the side. One bends you, the other one controls the bend. When you use them both at the same time, it extends you. So go ahead and use both of them. There you go. So now the Quadratus Lumborum is contracting, okay? And come back straight. Okay, so what is the primary reason of the Quadratus Lumborum? Again, like I mentioned, spinal stability. But most people hurt their back when they're twisting, right? So that's why we always tell people to pivot, because you never know if something's too heavy and it's going to be too much load for your Quadratus Lumborum. So the other thing that the Quadratus Lumborum does, it prevents excessive rotary motion of the spine. So go ahead and put your hands on your shoulders, give yourself a hug. You gotta love yourself before you love anybody. Okay, now twist to the left, and here what you're going to see is you're going to see the Quadratus Lumborum activate, and it's preventing that excessive torque. Now go to the right, same thing. Okay, come on back. Now, when that muscle atrophies, when you hurt your back, you lay down, you put a cold pack and a hot pack, and you massage it, and you stick a lacrosse ball into it. Pretty much what you're doing is you're atrophying the muscle. So the number one thing you want to do when you strain that muscle is you want to strengthen it. Now you take the strengthening portion nice and easy, and then by 5 to 7 days it's completely resolved and you should never have to worry about it again. So you've hurt your back, either starting the lawnmower, lifting up a case of water and putting it into your vehicle, or you just had a baby and you're taking them out of the crib. You're bending over, lifting and twisting. Now you can't stand up completely, okay? That is Quadratus Lumborum pain, okay? So what do? You back off, right? Don't pull your knees to your chest. Do not take a lacrosse ball to it. And definitely don't go for a deep tissue massage. It's too early in the injury for any of that. What you want to do is you want to slowly start activating that muscle again. Now, it's painful, but at the same time, you're gonna make it a lot better quicker by actually starting to work it versus resting it and trying to relax it more. So the side plank per EMG activity, electromyographic activity, shows that that's the highest. The side plank will be the highest amount of recruitment of the quadratus lumborum muscle. Now, I don't expect you to get down on the side and start planking immediately after an injury, so you modify that side plank. Okay, so the best way to modify it is I've created something here with a chair and a TheraBall. The other thing you can do is you can use a kitchen counter or a bathroom counter. Okay, so the goal here is to go ahead and get into a side plank. All right. And the goal here is to try and maintain a perfect angle, right? So here, he's having to use both sides of the quadratus lumborum, but you can see that nice muscle belly really activating there. You can see him shaking a little bit, and that's to be expected. That's exactly what you want. You want that shaking. That tells you that the muscle's working. And rest, right? How long do you hold? 20 seconds. If 20 seconds is too long, hold for 10. I want you to repeat it 4 times on each side, and then you're done for the day. Do it again mid-afternoon and right before you go to sleep. Stay active. Remember, don't pull your knees to your chest. Don't stick a lacrosse ball in it. Don't get a deep tissue massage. Let the muscle slowly unravel and heal from its injury. Let the inflammation process take its course. Okay? Once this gets easy, right, then you can add other things. Go ahead, side plank. Good. Now you can do things like lift your right arm towards the ceiling. That's really going to make it work now, right? Or if you're really feeling better and you want to even challenge yourself more, lift the right leg off the left leg. Now that's really working, okay? Good. So, once your quadratus lumborum feels good and you don't want this injury to occur again, it's a great idea to make that muscle really firm, really strong. That way it prevents any type of injuries in the future. So what you do is you take exactly what I just demonstrated, or what Juan just demonstrated, and you do it on the floor. That's today's video. I'm Dr. G, Callus Physical Therapy. Thank you for watching. Don't forget to click like and subscribe, comment below, and we can bring you new videos. That's exactly what this video is based off of. Someone made a comment, so I hope that answers your question, and I hope it helps. And don't forget, today we're starting our mini series on YouTube where I'm personally training a individual that is trying to get their professional golf licensing card. Alright, so check it out, look for it, will be coming up soon.